Happy birthday, Louise Brown. Today is a very special day for me and for millions of infertile couples. To parent a child is the dream of every married couple. To hear their baby's sweet voice is the joy of the marriage. But for many couples, that is a percentage of 10% of the couple, they were not able to do it naturally. For them, this new technique, test tube baby, that is in vitro fertilization, has given chance. For this millions of couples, life has changed because of the advent of in vitro fertilization in the infertility practice. This was made possible by the effort of Dr. Steptoe and Edward. They are the pioneers who has made the first IVF baby, Louise Brown, who is now 35 years old, now who has mothered a child also. So now today, being a special day for in vitro fertilization, I am going to give a talk on this in vitro fertilization, this technology which has come into practice from 1978, which is now becoming more popular, giving more hopes to the infertile couples. In vitro fertilization is where the egg and the sperm are fertilized outside the body. That is, in vitro means it's a glass, that is, we call it as a test tube, where the egg and the sperms are meeting, fertilized there, and then this embryo is cultured in the laboratory and the embryo is transferred into the uterus of the woman. This is the basic step of in vitro fertilization. It is not for all the infertility couple that we advise in vitro fertilization because it needs more time, more money, and it needs effort also. But it is not indicated for all infertility patients, but for some, it is the only way they can parent a child. Like if they're fallopian tubes is the uterine tubes where usually the fertilization, where the egg and sperm meets. This tube, when it is blocked, the natural process of the egg sperm meeting is not taking place. This was the first indication, that is, Louise Brown's mother had a tubal block, and then Dr. Edward tried in her, and then she was born. So this was the first indication for in vitro fertilization. But nowadays, because this technique has changed a lot, we are using this technique for more and more indications, like male infertility, where the sperm count is very, very less, IVF, or if it is very less due to the advance in the in vitro fertilization technique, one more technique where we call it as intracytoplasmic sperm injection. This is done for men who are having only very few motile sperms, or whose sperms we have to take it from the testicular tissue or like that. Then we can use this ICSI method to make them a father. Other things are like immunological or unexplained infertility, or endometriosis when they are having a severe endometriosis. Endometriosis is a condition where there are blood clots inside the pelvis, that is around the uterus and the ovaries, where they cannot have a normal fertility chances. Then we can use this IVF for them also. But nowadays a newer indication is also occurring where we can do the fertility preservation. Like if the woman or man, they have to, unfortunately, if they are having any cancer condition where they have to undergo treatment for the cancer, they can preserve their gametes, that is egg or the sperm, and then they can utilize it later on to become, to prove their fertility. This is called as fertility preservation. for this also we can do IVF. And how it is done, for this the woman and men has to undergo some investigation to rule out other diseases and then to make them suitable, whether they are suitable to undergo this thing. Once they are fitted and once they are recruited for this, the treatment is mainly for the woman. Once she has produced enough egg, this is seen by the ultrasound. We will be monitoring her. Once the egg number is okay and the egg size is okay, we will take the egg outside the body of the woman. This is a small procedure, but we will do it under anesthesia, and the eggs are taken out from the body of the woman. And then other process is done in the laboratory where the sperm is mixed with the egg and the fertilization happens. And the embryos, we will watch it and we will take the good embryo and we will be transferring this embryo into the uterine cavity of the woman. After that, she can go home and then she can do her routine work, but she should not do a very strenuous exercise and other things too. And within another 15 days, we will be knowing the results of the procedure. Because of a lot of advances in this method, nowadays we are getting good results, but we cannot say 100% we will get. It has also got, because it's a mode of treatment, so it has got some side effects. When we are giving injections, the woman can go for overstimulation, and because of that she can have some problems. Or when we are giving more embryos, she can have multiple pregnancies, like that is twin pregnancies or triplet. For some couple, it is a joy to have two babies at the same time. That is, it is like a jackpot. But this twin pregnancy has got a twin pregnancy or triplets. They have some other complications like preterm deliveries. The baby has to be very small and it has to be kept in the incubator and all. So we wanted to avoid this. So nowadays we are aiming for a single pregnancy only, but these complications sometimes we cannot avoid.